We're Team Hedgehogs, and we'll be talking about solving cholera in Yemen. Introducing the issue. Cholera is a diarrheal illness caused by bacteria that's transmitted through contaminated food and water. Generally, cholera tends to occur where access to safe drinking water, proper sanitation, and employment of hygiene practices are limited. This is a generally curable infection, but it will result in death if not treated.
So this is our storyline with no solutions. Many people live in poverty in Yemen. 6 months later, an outbreak occurs with cholera. Many kids start to feel sick and need to start to leave school to heal. Try going to the nearest hospital, but it was bombed due to the ongoing war. Symptoms get worse and kids are getting very ill. Many people pass away from cholera.
So, why cholera in Yemen? Cholera has been an issue in the past in Yemen. In 2017 and 2019, Yemen accounted for 84% and 93% of all cholera cases worldwide. And it's still an issue today. In the last 3 months, Yemen has one of the four highest incidence rates globally and also has the third most cases globally in 2024. Looking at some of the causes and context, it's important to mention the civil war in Yemen. It began in 2014 and is still ongoing. All the violence has essentially damaged both the healthcare infrastructure of the country as well as the water sanitation infrastructure. So the violence has left only 51% of Yemen's health facilities fully functioning. And it's also destroyed much of Yemen's sewage treatment plants and water systems. As a result, 14.5 million people lack safe drinking water and adequate sanitation. And all of this combines to create conditions that are extremely susceptible to cholera transmission.
And now we move on to people who are the most susceptible to cholera. So the people who are most susceptible to cholera are young children, especially those under 5 years old, and also older people, those over 60 years old. And a statistic we found is that children under the age of 15 account for 46% of the cases, and those over 60 represent 33% of fatalities. And social determinants of health of cholera are children in urban slums, internally displaced people, and refugee camps are most particularly vulnerable. Also, poverty, lack of education, lack of access to affordable health care, and lack of safe living conditions go hand in hand with cholera prevalence. And a statistic we found is that from 2010 to 2021, 97% of cholera cases occurred in countries with the lowest levels of water and sanitation services.
So some potential solutions. Our solution number one is our Clean Water Project, which would be a volunteer project aimed to create new sources of water, in one region, and would need permission from the Yemen government to ensure people's safety. Our mission would be to provide clean water to a region, observe and publish the results, and to use those results to promote additional funding. So the sustainability of this project would rely on the results. Um, More results would equal more funding, and the project would continue. Results that we're not looking for would reduce funding and end the project eventually. Our budget would be $30,000. We aim to make four shallow wells with also money to pay the workers. We aim to make boreholes later on with more budget to make it more sustainable and to widen the scope of the project.
So solution number two is iodine tablets. They're cost efficient and they're simple. They're used in areas where like the water treatment is not reliable. It takes 30 minutes for the iodine tablet to fully work, and we would have volunteers hand out tablets to families in Yemen. So our budget for the iodine tablets is $20,000 or $20,000. Um, each container would cost $9.95, and in each container would hold 50 tablets. If you give out 1,900 containers, there will be 95,000 tablets in total. That would leave us at a price of 18,905, and our shipment to Yemen would cost $1,095. Sustainability for iodine tablets. Many volunteers would want to help out their community slash home. Iodine tablets are easily available, they're cost efficient, and for this to be more sustainable, we would need a bigger funding. So here's our storyline with solution one and two. Many people live in poverty in Yemen. 6 months later, a cholera outbreak occurs. People start to get sick from cholera. Volunteers start handing out iodine tablets to purify the water and build new wells. Less people are getting sick and going back to school. Yemen has clean water now, and cholera isn't a threat anymore.
So, in summary, we believe that by starting small with individual Yemen towns in our $50,000 budget, we believe that we can make a difference over the course of a year in those towns. We would then plan to publish the results and encourage more investment from partners like the World Health Organization. And one town at a time, we think the clean water infrastructure would grow, and this would allow for the healthcare system to rebuild after the war. We appreciate your time and thank you.